What is hepatitis? Hepatitis is an inflammation of the liver. Inflammation is swelling that happens when tissues of the body are injured or infected. The liver is a vital organ, and when it is inflamed or damaged, its function can be affected, including the ability to process nutrients, filter the blood, and fight infections. Hepatitis can be an acute, short-term infection or a chronic, long-term infection. Some types of hepatitis cause only acute infections. Other types can cause both acute and chronic infections. Treatment options vary depending on which type of hepatitis you have. You can prevent some forms of hepatitis through immunizations and lifestyle precautions. The 5 types of viral hepatitis. Viral infections of the liver that are classified as hepatitis include hepatitis A, B, C, D, and E. A different virus is responsible for each type of virally transmitted hepatitis. Hepatitis A is always an acute, short-term disease, while hepatitis B, C, and D are most likely to become ongoing and chronic. Hepatitis E is usually acute but can be particularly dangerous in pregnant women. There are effective vaccines to prevent hepatitis A and hepatitis B. Although there is currently no vaccine for hepatitis C, there are effective treatments, which is why testing and early diagnosis of infection is crucial. Common symptoms of hepatitis. The symptoms of hepatitis can be confounding, ranging from mild, short-lived flu-like symptoms, e.g., fever and fatigue, to more classic ones, such as jaundice, or even no symptoms at all. Typically, once the symptoms of hepatitis become obvious, chronic liver disease and liver damage are well underway. Serious liver damage can have dire and even life-threatening complications such as cirrhosis and liver cancer. It is important to know that doctors can't diagnose the type of viral hepatitis infection through the symptoms. To find out if your viral hepatitis is caused by one of the hepatitis viruses, you need a blood test. Symptoms of the 3 types of hepatitis vary little. In the case of acute viral hepatitis, if symptoms occur, they will begin to appear during the prodromal stage of infection, when the virus has begun to aggressively replicate and spread to the cells of the liver, called hepatocytes. Symptoms include general tiredness or fatigue, muscle pain, myalgia, joint pain, arthralgia, fever, nausea, vomiting, diarrhea, loss of appetite. Pain in the upper right part of the abdomen, generally mild, but constant. Red, raised hives, most commonly seen with hepatitis B. Changes in the way things taste or smell. Smokers will often develop a sudden distaste for cigarettes. Within several days of these early signs, the infection will trigger the buildup of bilirubin, an orange-yellow pigment produced when the liver breaks down old red blood cells. This compound can rapidly accumulate in the body, causing telltale signs of hepatitis: jaundice, yellowing of skin and whites of the eyes; choluria, darkening of urine; pale or clay-colored stools. Symptoms of acute viral hepatitis rarely become severe. However, fatigue can persist for weeks and, in some cases, even months. In most cases, acute symptoms resolve in about 4 to 8 weeks. One exception is hepatitis D, in which acute liver damage is more common. How hepatitis is diagnosed. 1. History and physical exam. Your doctor will review your medical history and risk factors for infectious or non-infectious hepatitis. Next, your doctor will do a physical examination around your abdomen. If he finds that you have an enlarged liver, he will find the cause and order blood tests. 2. Liver function tests. Liver function tests use blood samples to determine how efficiently your liver works. Abnormal results of high liver enzyme levels may indicate that your liver is stressed, damaged, or not functioning properly. 3. Other blood tests. If your liver function tests are abnormal, your doctor will likely order other blood tests to detect the source of the problem. These tests can check for the viruses that cause hepatitis. They can also be used to check for antibodies that are common in conditions like autoimmune hepatitis. 3.1. Ultrasound. This test allows your doctor to take a close at your liver and nearby organs in your abdomen. It can reveal fluid in your abdomen, liver damage or enlargement, liver tumors, abnormalities of your gallbladder. Sometimes the pancreas shows up on ultrasound images as well. This can be a useful test in determining the cause of your abnormal liver function. 3.2. Liver biopsy. A liver biopsy is an invasive procedure that involves your doctor taking a sample of tissue from your liver. It can be done through your skin with a needle and doesn't require surgery. This test allows your doctor to determine how infection or inflammation has affected your liver. It can also be used to sample any areas in your liver that appear abnormal. How hepatitis is treated. Treatment options are determined by which type of hepatitis you have and whether the infection is acute or chronic. 1. Hepatitis A. Hepatitis A usually doesn't require treatment because it's a short-term illness. Bed rest may be recommended if symptoms cause a great deal of discomfort. If you experience vomiting or diarrhea, follow your doctor's orders for hydration and nutrition. The hepatitis A vaccine is available to prevent this infection. Most children begin vaccination between ages 12 and 18 months. It's a series of 2 vaccines. Vaccination for hepatitis A is also available for adults and can be combined with the hepatitis B vaccine. 2. Hepatitis B. Acute hepatitis B doesn't require specific treatment. Chronic hepatitis B is treated with antiviral medications. This form of treatment can be costly because it must be continued for several months or years. Treatment for chronic hepatitis B also requires regular medical evaluations and monitoring to determine if the virus is responding to treatment. Hepatitis B can be prevented with vaccination. The CDC trusted source recommends hepatitis B vaccinations for all newborns. The series of 3 vaccines is typically completed over the first 6 months of childhood. The vaccine is also recommended for all healthcare and medical personnel. 3. Hepatitis C. Antiviral medications are used to treat both acute and chronic forms of hepatitis C. People who develop chronic hepatitis C are typically treated with a combination of antiviral drug therapies. They may also need further testing to determine the best form of treatment. People who develop cirrhosis, scarring of the liver, or liver disease as a result of chronic hepatitis C may be candidates for a liver transplant. Currently, there is no vaccination for hepatitis C4. Hepatitis D. No antiviral medications exist for the treatment of hepatitis D at this time. According to a 2013 study trusted source, a drug called alpha interferon can be used to treat hepatitis D, but it only shows improvement in about 25 to 30% of people. 5. Hepatitis D. Hepatitis D can be prevented by getting the vaccination for hepatitis B, as infection with hepatitis B is necessary for hepatitis D to develop. 6. Hepatitis E. Currently, no specific medical therapies are available to treat hepatitis E because the infection is often acute. It typically resolves on its own. People with this type of infection are often advised to get adequate rest, drink plenty of fluids, get enough nutrients, and avoid alcohol. However, pregnant women who develop this infection require close monitoring and care. Tips to prevent hepatitis. 1. Hygiene. Practicing good hygiene is one key way to avoid contracting hepatitis A and E. If you're traveling to a developing country, you should avoid local water, ice, raw or undercooked shellfish and oysters, raw fruit and vegetables. Hepatitis B, C, and D contracted through contaminated blood can be prevented by not sharing drug needles, not sharing razors, not using someone else's toothbrush, not touching spilled blood. Hepatitis B and C can also be contracted through sexual intercourse and intimate sexual contact. 2. Vaccines. The use of vaccines is an important key to preventing hepatitis. Vaccinations are available to prevent the development of hepatitis A and B. Experts are currently developing vaccines against hepatitis C. A vaccination for hepatitis E exists in China, but it isn't available in the United States. Be careful with complications of hepatitis. Chronic hepatitis B or C can often lead to more serious health problems. Because the virus affects the liver, people with chronic hepatitis B or C are at risk for chronic liver disease, cirrhosis, liver cancer. When your liver stops functioning normally, liver failure can occur. Complications of liver failure include bleeding disorders, a buildup of fluid in your abdomen, known as ascites, increased blood pressure in portal veins that enter your liver, known as portal hypertension, kidney failure, hepatic encephalopathy, which can involve fatigue, memory loss, and diminished mental abilities due to the buildup of toxins, like ammonia, that affect brain function, hepatocellular carcinoma, which is a form of liver cancer, death. People with chronic hepatitis B and C are encouraged to avoid alcohol because it can accelerate liver disease and failure. Certain supplements and medications can also affect liver function. If you have chronic hepatitis B or C, check with your doctor before taking any new medications. Outlook. Different types of hepatitis have different chances of recovery. 1. Hepatitis A. This type normally resolves within 2 months without having any long-term effects, and the person will have lifelong immunity afterward. 2. Hepatitis B. Most adults recover within 90 days and have lifelong immunity. However, 90% of infants, 20% of older children, and 5% of adults develop a chronic infection. This can lead to severe complications, such as liver cancer or cirrhosis. 3. Hepatitis C. The infection is chronic in 75 to 85% trusted source of people who have it, and 1 to 5% of people will experience life-threatening complications. Treatment is available, but 15 to 25% of people will recover without it. When to see a doctor. If you develop any of the symptoms of chronic hepatitis, liver damage, or liver cancer, see your doctor. It takes only a blood test to detect the presence of a hepatitis virus in your body, which will determine what your treatment should be.